Hi, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon in San Diego, California, and I specialize in facial rejuvenation. So what is facial rejuvenation and what are some of the tools that we use as part of this program? So basically, the face ages naturally over time. This happens to all of us. And when it does, there's certain things that are consistent part of the aging process. One of the starting points of the aging process is fat loss. And what happens is during the 30s, early 30s, mid 30s, a lot of women especially love their faces at that time because there's a certain amount of fat that is dissipated as time goes on. And during the 30s, there's a high increased definition and a higher level of refinement to the face that many women find very attractive, and they appreciate those changes. Then as time continues, the face starts to lose a little bit more volume. And at that point, once you enter the 40s or late 30s, oftentimes the volume starts to get to a point where it leaves us looking tired. And specifically areas such as under the eyes, the temples, the loss of fullness in the cheeks, loss of volume in the lips, all these areas become a problem to a point where people want to do something about it. So on one vertical, you have the volume loss happening. On the second vertical, you have things that are related to sagging, and that happens much later. So for the moment, we're going to focus on the volume and the volume replacement options. So what happens when you lose facial fat? What are your options in terms of being able to correct it? Well, number one, probably the easiest thing you can do is use fillers. And you all know that the common terms like Juvederm, Restylane, Voluma, all these different types of fillers that are out there. And then there is a second level of correction, which is fat transfer. So what fat transfer means is basically we take fat from a different part of your body and replace the fat that has been lost in the face. And what makes this procedure so exciting and so incredible is the fact that because it comes from your own tissue, and once you graft it into the area such as the face where you've lost the volume, the fat becomes a permanent part of that area. And that's the best part about it. Because fillers, on the other hand, are temporary. Every 6 months, 9 months, a year, you have to replace them. So you're in and out of the offices getting, poked again and more treatments, wondering when the next time you should be coming in. So there's an up and down version of your face that people who use fillers get, where their face looks full right after treatment, they like it, and then eventually it starts to diminish and then they have to go back. So you're not stable over time. Fat transfer, on the other hand, is a stable procedure which leaves you looking the same over time, which is a really great thing about it. So how do we perform it? So fat transfer starts with, number one, identifying where in the face you've lost the volume, and then number two, where are you going to take the fat grafts from? Oftentimes, the areas such as the stomach or the thighs, either inner or outer thighs, is the ideal area for fat harvesting. So we take the fat from those areas through using a simple liposuction technique. It's very different than a liposuction that you would use when you're trying to remove fat from the body to sculpt the body, because in that case, you're using a high pressure vacuum which causes the fat to collapse, and you basically have dead fat at the bottom of your canister, which is no good for grafting because you want living tissue, viable tissue when you transfer. So a big difference. So the other aspect of it is the refinement process. How do you get the fat to be prepared for injection? Well, there's a number of different ways. You can spin the fat using a centrifuge so you can separate it from the fluid. You can strain the fat, or you can, in some cases, just like gravity, separate it. The less harm you do to the fat, the better it is, because you're going to have more viable tissue at the time of transfer. So once you get the fat isolated in a syringe and it's ready for injection, then the injection technique is really, really important. And this is what separates most surgeons, around the country or even internationally, because the technique in terms of being able to inject it both artistically and naturally is not that easy, because you have to be able to know how much of that fat is going to ultimately take. If you underestimate it, well, you're going to get a situation where you're going to look like you haven't had any result. If you overestimate how much you're going to inject, then you end up with a face that looks too full. If you inject it coarsely or haphazardly, you're going to get lumps and bumps. And remind you, these are permanent changes. So this makes fat transfer a very tricky and very potentially dangerous procedure if it's not done in the right hands. In my practice, I've been doing fat transfer since 2005. I've done about 4,500 cases over the last 15 years, and that is probably up there with the most number of fat transfers done on an international level. Because fat transfer is done so consistently and safely in our practice, we get to do it over and over again. And so in our practice, what we get is very stable, reproducible results that don't have the consequences that we were just mentioned. So as a result, it's a fantastic option for patients, either young or older, who've lost volume, and it gives them an opportunity to be able to have that lasting long-term result that you can't get with any other form of volume augmentation. I hope that answered some basic questions and gave a little bit of a primer. We'll have more information, more discussions on different applications of fat transfer, but as a basic standing point, this is a good launching point for us to discuss further treatments. All right, thank you so much. If you have any questions, please jot it down in our comment section. We'll make sure we answer them. And if you haven't already, subscribe to our channel, and we can continue to educate you on more and more exciting treatments in the realm of facial rejuvenation and facial plastic surgery. Thanks so much. Very nice. 1, 2,